the silent danger in your heart. Hello everyone, today we're going to talk about a topic that could change not just one person's life, but perhaps millions, the risk of a heart attack. Let me ask you a question. Do you check your car's oil level? Do you regularly measure the pressure in your tires? I'm sure the answer is yes. But how often do you check the health of your heart? That's where most of us pause and think. That's precisely why I'm here. Today, I'm going to teach you a test that can give you a crucial clue about your heart's health, right from the comfort of your home, by spending just 5 minutes of your time. This test doesn't provide a diagnosis, but it can warn you before you go down a dangerous path. So why is this so important? Remember, heart disease is the leading cause of death worldwide, and the scariest part is that many heart attacks occur without any prior symptoms. This test can help you spot that silent danger, the cholesterol misconception, and the real danger. Most of us think that cholesterol is solely responsible for heart disease, right? We assume, if my cholesterol is high, I'm at risk of a heart attack. If it's low, I'm safe. This is a major misconception. The truth is, the real cause of heart attacks and strokes is the arterial plaques that build up in our blood vessels. These plaques are like sediment in a riverbed. They slowly accumulate, and eventually they start to obstruct the flow of the river. Think about it. Even a person with normal cholesterol levels who eats a healthy diet can suddenly have a heart attack because of these plaques that have been quietly building up for years. The real catastrophe begins when these plaques rupture like a volcano, leading to a blood clot in the vessel. That's why focusing only on cholesterol levels is like looking at just the tip of the iceberg. The at-home heart attack risk test, the ankle brachial index, ABI. Now, let's get to how you perform this test. This test, known in the medical world as ABI, is based on a very simple principle. If there is narrowing or a blockage in your leg arteries, the blood pressure in your legs will be lower than the blood pressure in your arms. This difference gives us a critical clue about your vascular health. Test steps and details. 1. Preparation, phase 2 minutes. This phase is essential for getting accurate results. Environment, go to a quiet and comfortable room. Clothing, wear loose and comfortable clothing. Rest for at least 5 minutes before starting the test. This will allow your blood pressure to stabilize. Warnings, do not smoke or consume caffeinated beverages for at least 30 minutes before the test. If you have exercised, wait 30 minutes as well. Second measurement phase, 5 minutes. Now we will take the measurements. Make sure you have a digital blood pressure monitor and a pen and paper to write down the results. Step 1. Find the highest arm pressure. First, wrap the blood pressure cuff around your right arm and measure the systolic top and diastolic bottom pressures. Just write down the systolic pressure. Then repeat the same process for your left arm and note the systolic pressure. Select the highest of the two systolic values you recorded. This will be the highest arm pressure we use in our calculation. For example, if the right arm is 130 and the left arm is 125, the value we use is 130. Step 2. Find the highest ankle pressure. Now, wrap the blood pressure cuff around your right ankle. The trick here is to place the cuff right at the level of the ankle where you feel the strongest pulse. Take the measurement and note the systolic pressure. Finally, repeat the same process for your left ankle and note the systolic pressure. Select the highest of these two systolic values. This will be the highest ankle pressure we use in our calculation. For example, if the right ankle is 110 and the left ankle is 115, the value we use is 115. Third calculation and interpretation phase, 3 minutes. Now it's time to apply the magic formula. ABI equals highest ankle pressure divided by highest arm pressure. Using our example values, ABI equals 115 divided by 130 equals 0.88. So what does this result mean? Range 1.0 to 1.3. Excellent. These values indicate your arteries are healthy. However, this doesn't mean you have zero risk. Continue with a healthy lifestyle. Range 0.9 to 0.999. Be cautious. This indicates that a mild narrowing may have begun. It's time to review your lifestyle and consult your doctor. Range 0.8 or below. Danger. This indicates that there may be a serious blockage in your arteries. You must see a cardiology specialist as soon as possible. Range 1.4 or above, a different kind of danger. This high value may indicate that your arteries have hardened and lost their flexibility. This condition, often seen in diabetic patients, also requires a doctor's checkup. Conclusion: it's time for action. Remember, this simple test is just a first step. It can never replace a doctor's examination, a detailed blood test, or an EKG. However, the purpose of this test is to wake you up and encourage you to take action. If your test result falls into a risky category, consult a specialist without delay. Perhaps a shortness of breath or leg pain that you've ignored until now will take on a whole new meaning with the help of this test. Your heart is the most important engine in your body. Take good care of it. Exercise regularly, eat a balanced diet, and repeat this test every 6 months. Stay healthy. You can share which category your test result fell into in the comments.